Welcome to Invent Medical's crash course on the Dental Perio Chart. In this video, we'll walk through a general overview of the chart, how to start a periodontal exam, record measurements, and more. To start creating a chart, first go to the patient profile on the side of any module. Under the Action section, click on Charts. Tap Select Chart to view all available charts. From the chart library, choose the Perio Chart. This patient has no previous Perio chart, so click New Exam to begin recording one. Let's expand the chart to full screen for easier charting. Now let's first start on the right, where you'll find the selected tooth details. At the top, you can see the selected tooth number and jaw location, along with its 6 measuring sites displayed for a quick, clear view of all probing surfaces. Right below that, you'll find the measurement category tabs, along with the quick entry number pad and clinical surface indicators, which are bleeding, suppuration, plaque, and calculus, making it easy to log every clinical detail. And at the bottom, you can use the quick action buttons to skip the current tooth or seamlessly move directly to the next one. Now let's record all the clinical details for this tooth. Starting with entering the probing depth. You can do so by using the keypad on screen or your keyboard. Now that we've logged the probing depth, notice how the system dynamically visualizes all your recorded measurements across the chart in real time. Let's move on to recording the gingival margin, which can be logged in the exact same way. Once logged, the clinical attachment level calculates automatically. The system also flags any measurement in red when it hits critical danger thresholds, which you can customize in the medical settings. To record clinical surface indicators, you can click the buttons that are on the right or select them directly from the chart. A single click logs bleeding or plaque, while shift click logs suppuration or calculus. Let's finish logging the rest of the measurements. You can log the mucogingival junction directly from here. Next up is recording furcation involvement to grade multi-rooted teeth. Our final measurement for this tooth is mobility, used to evaluate tooth movement. Now that all of the measurements for this tooth are logged, let's explore some of the other functions available right in the chart. Missing or excluded teeth can be hidden by clicking the tooth number. The hidden tooth is now grayed out and left out of every index. You can also enable Triplets mode. This allows a single value entry to automatically fill all 3 sites of the tooth at once for faster logging. Let's try it. By entering a single value, it will automatically be applied to all 3 sites for this tooth. You can also click this button to change the entry direction. It defaults to advancing forward, but you can switch it to fit your workflow. Before exploring the rest of the features, let's quickly fill in the rest of the chart. With the chart fully completed, we can now explore the remaining options and features available. Let's look at the display options. We can navigate to different views from here. You can click Chart to view only the graphical chart illustration. Grid View shows every recorded value as numbers, tooth by tooth. Let's get back to the main view to bring the chart and grid back together on one screen. At the top, the BOP badge tracks bleeding on probing across all sites, while adjacent badges display overall plaque, mean probing depth, and clinical attachment level. Finally, let's quickly walk through these top toolbar controls. Starting with the visibility menu, which controls which measurements will be hidden or shown. Untick a row to hide it from both the chart and the grid. Let's look at the exam history now. Every past exam is listed with its indices, so you can compare over time. To add an exam note, first click this icon. Type in your findings, diagnosis, and plan for this exam. To save the chart in the Patient Documents folder, hit the camera icon. Finally, let's export the chart. Open the Print menu and select Preview to instantly review the full report right inside the system, saving you time by letting you inspect everything before deciding to print or download. Here is the view of the full periodontal charting document. Scroll down to check detailed periodontal statistics. From the top controls, you can print, download, or open the chart in a new tab. And that wraps up the full Perio chart. Thanks for watching. To learn more, check out our documentation page or try the live demo on our website.